I'm pleased to announce that we're taking another step forward in meeting the challenge of making recovery possible. We are continuing our work to develop compassionate intervention legislation, and we hope to be able to introduce it very soon. This would be a tool to help individuals who've lost the capacity to help themselves and are a danger to themselves or others. And if passed, Budget 2025 will provide $180 million over 3 years towards building 2 new compassionate intervention centres, one in Edmonton and one in Calgary, to lay the groundwork for the implementation of the Compassionate Intervention Act. These facilities, known as the Northern Alberta and Southern Alberta Compassionate Intervention Centres, would have 150 secure beds each and provide proper health care for patients with complex addiction or mental health needs, much more comprehensive than a traditional addiction treatment centre.
What society has done for too long is simply not working. Enter the Alberta recovery model and this compassionate intervention facilities that we're announcing today. No more facilitation of failed policies coming out of the West Coast and activists who think that we shouldn't be trying to help people with healthcare and heal them, but instead continue and facilitate the harm. Those policies have failed. Alberta is taking a stand. We care for those suffering from addiction. We care for their dignity as Albertans. We care for them as family members. We care for the sense of public safety that is being eroded as well under the policies we see under the Vancouver model.
There are 3 ways addiction ends: jails, institutions, and death. It's time for change, a change in our approach to turning our heads at the devastation around us. It is not compassionate to allow our loved ones to succumb to the throes of addiction. It's time for action. Protecting a person's right to refuse treatment when they lack the cognitive capacity to understand their illness is not true autonomy. It's abandonment.